To access your Evolve Interactive Dental Office digital charting or mounting exercises, you want to log into your Evolve account that you made, and the directions are in the introduction section. You're going to go to My Evolve, and after registering, you will see the Evolve resources in your My Evolve. You're going to select that. You're going to go to your student resources. You're going to go to Interactive Dental Office. Now you do need your pop-up blocker on because it will pop up in another window. You enter your name, and here you're going to either select the radiography exercises if we're doing the mounting exercises, or charting exercises if you are doing digital charting on evolve.com. So we'll first start with the charting exercises, and in your homework workbook list will be the patient that you are to do the digital charting exercises on. So let's go with Charles Fuller. And this area is just showing you what the procedure is. And if you hover over it, this will do a missing tooth, an amalgam restoration, a composite restoration. If there's decay, obviously the difference between the red and the blue is already done, red needs to be done. So if it says it needs to have a DO something, you would check this. So you can hover over each of them to see what they each mean. Now down here at the bottom, you're going to see where it says charting 1 of 27. So here we'll explain the first charting that you're supposed to do. So on the maxillary right, number 1 has an occlusal amalgam restoration and mesial decay. So it has an occlusal amalgam restoration, so that will be blue. And right here you can see this is for amalgam. If it was composite, it would be this one. But for an amalgam, number 1 has an occlusal. So you're going to click on this, and on number 1, you're going to select the occlusal. So that is an occlusal amalgam restoration on number 1, existing, so it's blue, and has mesial decay. So that's going to be needs to be done. If something has decay, then it needs to have a filling on it. So you're going to select the decay button, and we're still on number 1. You're going to select the mesial. So now number 1 is complete. The maxillary upper right, number 1 has an occlusal amalgam restoration and mesial decay. Existing occlusal amalgam restoration, and when it has mesial decay, it will be in red. So then we click next. Now it says number 2 has completed endodontic treatment and is restored with an MODLF amalgam, mesial, occlusal, distal, lingual, facial amalgam. And remember, facial can also be a buccal. Buccal and facial are just the cheek side. So it has endodontic treatment, completed endodontic treatment. So we're going to click on this and go to number 2. You can see it fills in blue on the roots. Upper maxillary roots have 3 roots. Mandibulars have 2. So we want to click all 3 roots. So it has completed and is restored. So that's completed with an amalgam. So this is again completed. So we're going to click that one, and it's going to be a mesial, occlusal, distal, lingual, and facial buccal. Now we're going to hit next again for number 3. Number 3 also has endodontic treatment. And remember, there's 3 roots on the maxillary and 2 on the mandibulars. We're going to click all 3 of the roots when they have endodontic treatment, and is restored with a DOL amalgam, distal, occlusal, and lingual. It also has mesial decay. So when it's decay, remember, it needs to be done on the mesial. Next, number 4 and 5 are missing. So this is a missing tooth. Number 4 and number 5 are missing. Next, number 6 has mesial and distal decay. Here's decay. So number 6, this is our mesial, this is our distal. Next, 7 has completed endodontic treatment and is restored with the porcelain fused to metal crown. So this is has completed. So it's number 7, endodontic treatment completed. Now our anteriors only have one root and a porcelain fused to metal crown, PFM. That's what that stands for. Click that. So now visually looking at this without seeing any of the words, I can tell number 7 has a porcelain crown with a root canal. I can tell there's decay on the mesial and distal. I can tell 4 and 5 are missing. I can tell 2 and 3 have root canals. So again, this is digital charting, and you would just go through all 27, and each patient has different amounts of charting and different charting to do. Once you get through the end and hit complete, your charting will be up here at the top and the correct choices will be down here at the bottom. So you can kind of match up what you did with what is correct. Again, you are to screenshot this to send it to us or to print and download. So you would be screenshotting this part and emailing it or sending a picture or printing it and giving it to your teacher and turning it in for your homework. So that's how we do digital charting on evolve.com.